Gentlemen, listen carefully. Put this simple natural powder on your tongue before intimacy and notice how your circulation begins to respond in a way many men haven't experienced in years. Many men report a noticeable return of warmth, sensitivity, and a stronger sense of readiness when blood flow improves. This is not hype, and it is not magic. It is physiology. When circulation improves, performance, stamina, and confidence naturally follow. My name is Dr. Sofia, urologist and men's health specialist, and today I want to explain something most men over 50 are never properly told. Intimate performance is not just about desire or age. It is primarily about blood flow efficiency. Erections are a vascular event. That means they depend on how quickly blood vessels open, how much blood flows in, and how effectively it stays there. When this system works well, performance is strong and reliable. When it slows down, everything feels weaker, even if desire is still present. As men get older, three major changes affect this system at the same time. Blood vessels lose flexibility. They do not expand as easily as they once did. The nerve signals that coordinate arousal become less efficient, meaning the response is slower. And most importantly, nitric oxide production declines. Nitric oxide is one of the most important molecules in the male circulatory system. Its job is to relax and widen blood vessels so blood can flow freely. When nitric oxide levels are high, circulation is smooth and responsive. When they drop, blood flow becomes restricted and performance is directly affected. This is one of the main reasons many men notice changes after 40 and 50, even without any major disease. Now, here is where the science becomes important. There is a natural amino acid called L-citrulline that plays a direct role in restoring this pathway. L-citrulline is not the final active compound, but it is one of the most effective ways to support nitric oxide production naturally. Once you take L-citrulline, your body converts it into L-arginine. And L-arginine is the amino acid directly used to produce nitric oxide inside the blood vessels. This is the key mechanism. Here is why L-citrulline is often preferred over L-arginine itself. When you take L-arginine directly, a large portion is broken down in the digestive system before it reaches the bloodstream. That limits its impact. L-citrulline bypasses this problem. It is absorbed, processed through the kidneys, and then converted into L-arginine inside the bloodstream, leading to a more stable and sustained rise in nitric oxide levels. This is why many clinical discussions and studies highlight L-citrulline as a more efficient way to support circulation compared to taking L-arginine alone. Some men choose to take L-citrulline powder under the tongue before intimacy. This is known as sublingual use. The idea is that certain compounds may absorb through the small blood vessels under the tongue and enter circulation more quickly. While the strongest research is based on oral supplementation, many men prefer this method for timing purposes, usually about 15 to 30 minutes before intimacy. Clinical research on L-citrulline supplementation commonly uses doses between 3 and 6 grams per day, depending on individual needs and tolerance. Many men start at lower doses and adjust based on how their body responds. The key point is consistency and proper use, not excessive dosing or unrealistic expectations. However, safety must always come first. If you are taking medications for blood pressure, heart conditions, or especially nitrates, you must consult a healthcare professional before using L-citrulline. Because it influences nitric oxide and blood vessel dilation, it can interact with cardiovascular medications and affect blood pressure levels. It is also important to understand that this is not a replacement for medical treatment. If a man is experiencing persistent erectile dysfunction, diabetes-related vascular issues, nerve damage, or advanced cardiovascular disease, a full medical evaluation is essential. In some cases, erectile changes are an early warning sign of deeper circulation problems that should not be ignored. That said, when used responsibly, L-citrulline can be part of a broader strategy to support healthy circulation, and it works best when combined with lifestyle habits that improve vascular function, regular exercise, quality sleep, hydration, stress control, and reducing alcohol intake. When these factors come together, many men notice meaningful improvements in overall energy, physical performance, and intimate confidence. Because nitric oxide does not only affect one area of the body, it impacts the entire circulatory system, heart, muscles, brain, and reproductive organs. That is why improving this pathway often leads to broader benefits beyond intimacy alone. So the key takeaway is this: in many men, the body has not lost its ability to perform. It has simply become less efficient at triggering and sustaining strong circulation. When you support the nitric oxide pathway properly, you are not forcing anything artificial. You are restoring a natural biological function that already exists within your body. If you have heard about L-citrulline before or are considering it, share your thoughts below. And if you have questions about circulation, performance, or men's health after 50, leave them in the comments. I read them regularly. This is Dr. Sofia, and remember, strong circulation is the foundation of strength, confidence, and vitality at every age. When the blood flows properly, the body responds the way it was designed to.